All right, good evening or good afternoon, depending on how far west and south you may be. My name is Steve Leifman, and I am the co-chair of the Judges Psychiatric Leadership Initiative. And it is my privilege to welcome all of you this evening. I would first like to introduce my co-leaders that participate with me and have helped organize tonight's event and work with us through the year. We have the Honorable Justice Catherine Zinoff, Dr. Michael Champion, and Dr. Sarah Vincent, who do tremendous amount of work through the year and done amazing work to help us get us to where we are today. So I want to thank them. I also want to thank the Council State Government's Justice Center and Hallie Fader Tao, and from the American Psychiatric Association Foundation, Christopher Chun-Seely. The two of them have really also done remarkable work to get all of our work out to all of you and help organize tonight. So I'd like to welcome all of you to the inaugural Judges and Psychiatrists Leadership Initiative Summit. For us, this is a bittersweet event. We are here during Mental Health Awareness Month to recognize both the important work happening across the country to reduce the overrepresentation of people with mental illnesses in the criminal justice system. And we're also here to recognize and honor our dear friend, the late Judge Stephen Goss. It's just over 15 years ago that Justice Evelyn, Stratton, and I, one of tonight's honorees, congratulations on the well-deserved recognition, with the help of Dr. Hank Stedman of the Gaines Center and Mike Thompson and Fred Osher, Dr. Fred Osher from the Council of State Governments, really helped us form originally the Judges Psychiatric Leadership Initiative. It was a small group of judges who were very passionate about this issue and realized that most of the reform in the country in this arena was coming through the judiciary. And from a small nucleus of judges, we have grown tremendously over the last 15 years. About 5 years after our beginnings, we were very fortunate to team up with the American Psychiatric Association Foundation, who joined with the Council of State Government Justice Center to really help us put all the staffing together. And we went from the Judges Leadership Initiative to the Judges Psychiatrist Leadership Initiative. And together we have developed and provided trainings in half the states around the country for judges to really equip them on how to recognize mental illnesses in their courtrooms and how to respond appropriately, as well as how to partner with the different behavioral health entities and psychiatry to help develop better and more effective treatment programs so individuals with these illnesses would stop cycling through the criminal system and get the care that they so need and deserve. We now have over 3,000 judges and psychiatrists and others who have joined our JPLI, subscribing to our free newsletter, participating in our trainings, and advising the development of our policy guides, like the one you'll hear about tonight on competency to stand trial. We are very honored to be here tonight also to recognize some of the extraordinary leaders through the Judge Stephen G. Goss Memorial Award for Leadership. Judge Goss was an active member of the Judges Psychiatrist Leadership Initiative, providing trainings across the country and ensuring that the perspective of rural communities was always heard and helped us in so many ways in so many different advisory groups. He was a very kind and thoughtful man, and while he had a very reserved demeanor, he was the kind of person, though, that when he spoke, everyone listened because he always had something incredibly important to say. His many contributions to our efforts were always considerate and impactful. Shortly before his passing, I did a training with him in Atlanta, where he was, in fact, I don't think I'd ever seen him so animated and so passionate and clearly so brilliant. He inspired many of us through his work and his commitment to this cause, and we're just hopeful that this award in his memory will help continue his legacy. And as we think about honoring Judge Goss's memory, we must also acknowledge that this was a tragic loss through suicide. And sadly, this is an opportunity for all of us to reflect that mental illnesses just do not discriminate, and that we need to openly talk about mental health to reduce the barriers so that we can get people the care that they so desperately need. Raising awareness about mental illness and getting people connected to care will be our theme tonight. You will hear about it in the work of our honorees, and you will hear about it through our policy roundtable on the competency to stand trial. Now to introduce the Judge Stephen S. Goss Leadership Award. I'm honored to turn this over to Justice Michael Boggs of the Georgia Supreme Court. Justice Boggs has won numerous awards throughout his legislative and judicial career, and he currently chairs the Mental Health Courts and Corrections Subcommittee of the Georgia Behavioral Health Reform and Innovation Commission. He also serves as the chair of the Council of State Governments Justice Center Advisory Board. He was a close friend of Judge Goss, and he has been a dear friend to the JPLI. Justice Boggs, thank you so much for being here with us this evening.
Thank you, Judge. I'm honored to be with you and honored to be able to honor my friend, Steve Goss. It's really my pleasure to be here in several different capacities, many of which you have mentioned. First, in my role on Georgia's State Supreme Court and as chair of the Mental Health Courts and Corrections Subcommittee, which you mentioned, of the Georgia Behavioral Health Reform and Innovation Commission, a creation of our current governor, Brian Kemp. Through those lenses, I see the critical role that judges play as leaders, bringing different parties to the table for the sort of really candid conversations that are needed for really system change. I'm also here in my capacity as chair of the Council of State Governments Justice Center's Advisory Board. I'm very proud of the Justice Center and the work that they're doing across the country, and very honored that they would see fit to honor my friend, Judge Steve Goss, for his work in this field. As you know, the Justice Center has supported the Judges Leadership Initiative and now the Judges and Psychiatrists Leadership Initiative as it has evolved over the last 15 years. The work, as you mentioned, on competency to stand trial alone, which I think we're going to be turning to later, is just one example of how the Justice Center and the JPLI bring together from diverse experts to really develop practical recommendations for policymakers on these very difficult cutting edge issues. And I've also come with a perspective of having, in my former life as a trial court judge, running and presiding over an accountability court, an adult felony drug court program, where I encountered many of these issues and many of the individuals that I dealt with in that capacity. And then lastly, of course, tonight's particularly important for me because of the personal relationship I had with Judge Goss. He and I served as colleagues on the Superior Court bench in Georgia in different judicial circuits for several years. We both created and presided over accountability courts in our respective circuits, and were he was certainly a leader and trailblazer in that respect. And then more than that, we were just personal friends, very close friends, both from South Georgia. Often he and I discussed the importance of these court programs. We both agreed that notwithstanding our subsequent appellate work, that our most satisfying part of our career was the work that we had in accountability court programs in the southern part of the state. Steve was in fact a very valuable resource for me when I created my drug court program, offering up every imaginable resource from program design advice to participant handbooks and to templates for every imaginable order that might be needed through that program. We were also colleagues on Georgia's Intermediate Appellate Court, the Georgia Court of Appeals, and I recall finally the many occasions that he would come by my office, always with an ample supply of candy for my staff, and we would talk about the transition from being trial court judges to appellate court judges in this state. I then subsequently moved to the Supreme Court, and he and I stayed in touch, and was really saddened, of course, at his loss. But I know that the folks that know him are aware of this, but I think it bears repeating that he was really the consummate accountability court judge. He he understood and focused foremost on the needs of those in his care. He viewed the justice system really as a tool to help people, not as a hammer, not as an opportunity to punish folks. His views of the role of a judge as really a remediator and as a partner in leveraging the resources of the judiciary to the benefit of the public and to those impacted by the system was remarkably innovative. And I think he alone is personally responsible for having sparked an entire generation of judges in Georgia that viewed their role and now view their role similarly. He's really worthy of honor and remembrance for all he did to change the lives of so very many people. And I'm glad to have had the opportunity to know and learn from him. I was able to talk with Ms. Goss about the idea of establishing this leadership award in her husband's memory so that his work would live on, and we hope help shine a light on other leaders working hard around the country to improve things for those who often cannot advocate for themselves. And I'm very honored and pleased to be here tonight helping that idea become a reality by recognizing 3 extraordinary leaders in this regard, leaders that I know embody the characteristics and traits that Judge Goss was so known for. First, I'd like to recommend, before we get to the award recipients, I'd like to welcome a fellow Georgian. Bill Fazekis is with us tonight, and he's going to share his own story, personal story about Judge Goss's leadership. So at this time, I'd like to turn it over to you, Bill. Welcome.
Thank you, Justice Boggs. Before I start, I want to say that the virtual background I'm using is an actual picture of Judge Goss talking to a participant enrolled in the mental health court program. I thought it might add a nice touch and help set the mood for my thoughts. As Justice Boggs said, I'm a member of the treatment team here in Dougherty County, Georgia. I work as a case manager in the mental health court that Judge Goss founded. But I'm also a past participant and graduate of that same treatment court. In fact, I sat in that same chair behind me many years ago. I was chosen to speak about Judge Goss tonight to give the unique perspective of all the fortunate people who actually worked with him and the fortunate people who were past participants in his program. Everyone who knew Judge Goss deeply admired and respected the man who was such a wonderful leader, a leader and judge who was so knowledgeable and passionate about mental health courts. And for the past participants like me who were enrolled in his program, we directly benefited from Judge Goss's compassion and empathy. But most of all, we were lucky to have his thoughtful guidance and encouragement, especially when we struggled with our mental health and substance use issues in the criminal justice system. I think it's important to remember Judge Goss because on top of all his groundbreaking work helping establish mental health courts across America, he always kept his primary focus on the treatment program he founded and on the participants he was helping right here in Dougherty County. Patricia, our treatment court coordinator, who deeply admired and respected Judge Goss and was with him from the very beginning, case manager Mary Jones, court reporter Melissa Griffin, public defender Sandra Satchel, assistant district attorney April Wynn, and our judge Victoria Darasaw. On behalf of the whole health court team and on behalf of all the participants through the years whose lives were touched by Judge Goss, I want to thank Hallie and the Judges and Psychiatrists Leadership Initiative for honoring Judge Goss's memory with these. Before I go, I wanted to tell a story about Judge Goss. And this story will reveal Judge Goss's understanding of the mental health court system. Several years after I graduated from the program, I got a hold of my criminal record. And as I thumbed through it, I saw page after page after page of things I had done that I had totally forgotten about. And I remember saying to myself, I don't want another word added to this record. And I used that criminal record to motivate me in my recovery because I'm motivated by consequences. And shortly after I looked at my criminal record, I got this brilliant idea. And I went to Judge Goss and I said, Judge Goss, I've got an idea to help improve the treatment court. And I said, during the graduation ceremonies, I recommend that you hand, in addition to hand the participants a certificate of completion, also hand them a copy of their criminal record. And Judge Goss looked at me and he said, Bill, I know you, and I know you're motivated by consequences, thinking about the consequences of your past. But different people by things, he told me, and not everyone would be as motivated by their criminal record as you are. And for some people, it might be, and might even be discouraging for their recovery. So, yeah, I thought that was, that made a lot of sense to me. In preparing my remarks for tonight, I noticed that the JPLI's mission statement talks about addressing overcriminalization of people involved in behavioral health issues. And so I knew that, you know, thinking back on it now, Judge Goss was thinking on a whole deeper level than I was about, you know, my recommendation. And I think there were plenty of reasons why Judge Goss decided that my brilliant idea about giving a criminal record to people who were getting a wonderful certificate of completion wasn't such a brilliant idea. And Judge Goss was vital in my recovery, and I deeply, deeply miss him. And so with that, I'll now turn it back over to Justice Boggs, who will begin the award ceremony.
Well, thank you, Bill. You are really a living tribute to Judge Goss. I mean, I know I speak on behalf of accountability court judges across the country who all speak so favorably of just being able to make a difference in people's lives. And so your story is really very touching. And it's those kinds of stories, I think, that drive the judiciary's involvement, embracing the work of accountability courts, because you're truly a success story. I know that Judge Goss would be very proud of you, Bill, and was very proud of you. And so please keep up the good work in Daugherty County and in Albany, and really you're honoring Judge Goss, all of you that work in that court program. So thank you. So everyone else kind of has an idea of how these inspirational leaders that we're honoring here wound up here tonight. I thought I'd give you a brief background. We and our partner nonprofits working in the courts and psychiatry opened a national nomination period this spring. A selection of committee of judges, psychiatrists, and people with lived experience reviewed the nominations for demonstrated leadership, including a commitment, and importantly, including a commitment to equitable outcomes. The winners that you're going to hear from tonight really rose to the top of an extraordinary group. Picking these winners was not easy. The truth of the matter is there are good judges and psychiatrists across the country doing phenomenal work in changing lives, changing systems, and improving outcomes. But I want to announce the first winner tonight for the first Judge Stephen S. Goss Leadership Award, and that goes to Evelyn Lundberg Stratton, retired Justice of the Supreme Court of Ohio. Justice Stratton exemplifies how a judge can use her role to bring people together for positive change. As a state Supreme Court justice, she established the Supreme Court of Ohio Advisory Committee on Mental Illness in the Courts, which indeed became a model for courts around the country. Following her retirement from the bench, she has been a leader of the Ohio Attorney General's Task Force on Criminal Justice and Mental Illness, director of Stepping Up Ohio, a program that has been worked at tirelessly by my friends at the Justice Center and very successfully across this country in working to reduce the prevalence of those with mental illness in our county jails. She has also been a member of Recovery Ohio Advisory Council and a member of the board of directors of the American Psychiatric Association Foundation. Back in 2004, Justice Stratton worked with Judge Leifman to establish the Judges Leadership Initiative as the first place that judges interested in this issue could come together to learn from each other, and support each other in this important work. So I think it's only fitting that this group has grown to the size it is today to be able to honor her for her work. And so please join me in recognizing the extraordinary work of Justice Evelyn Stratton. Justice Stratton, thank you for being with us. Please give us some words.
Thank you so much. I don't know if you can hear me. I'm hoping you can.
We can hear you.
Okay, excellent. Thank you so much for this great honor. I really didn't expect to receive this because there are so many judges that have been such leaders in this field that I was just very, very touched. I so fondly remember Judge Goss. I mean, he was just so kind and thoughtful. And I often thought if you came before him for his court hearing, you would feel cared for, you would feel safe, you would feel like he really could help you, which is very strange to feel that way in a court setting, but that's what mental health courts do. So I'm really honored to accept it in his name. Many in my family have been touched by mental illness. I've lost some very close friends to suicide. And so I know how much we need to continue to make this effort to make a difference in this area. It's amazing how things have grown. When I first started, I was on the Supreme Court. I had 10 people I called to a meeting and I said, I have no idea what I'm doing. I have no staff, no background, no training, no education, no money. But I have one thing that I think is somewhat effective. I have a big title. And when I ask people to come to a meeting, they come. And that has really been the success of a lot of the mental health court judges, in that they can convene, they can bring people together, and they can all work together. Things have really, really changed a lot. When I started first working on this years ago, we had 100 CIT officers trained. We have now over 7,500 in Ohio, 10,000 trained that include also first responders and dispatchers and other groups. We had 7 drug courts. Now we have over 200 specialized dockets. When I started working here and nationally on vet courts, there's just a couple, started mostly by mental health court judges. There are now hundreds of veterans courts and veterans justice outreach specialists. So when anyone is discouraged, I always say we have really made a difference. We have made progress. That certainly means we have a lot further to go, but we certainly have made progress. I'm very honored now to join the APAF board, get reconnected in a bigger way with the American Psychiatry Association Foundation, and it's now the JPLI. And so we really have an ability to work together and make a lot of difference. So I just feel like there's so much that has happened, but so much that still can be done. And for those many, many people that are on this list, as participants, for those who have come before and will come after, thank you so much. We appreciate all that you are doing and all the wonderful efforts you're making to make lives difference. We have to remember we are doing this for those we love, for those we care about, for those who have mental illness, to make their lives better. So I'm very honored to receive this. Thank you.
Dr. Vincent.
Good evening. I have the distinct pleasure of introducing awardee Dr. Kristen Ochoa, who, I don't know if she remembers this or not, but we met briefly at an APA meeting where I attended a talk that was given by some of her mentees that was absolutely fantastic. And I think that's always a reflection of the mentor as well. But Dr. Kristen Ochoa, MD, MPH, is Medical Director for the Los Angeles County Office of Diversion and Reentry in the Department of Health Services and Assistant Clinical Professor at the UCLA David Geffen School of Medicine. She completed her MD and her forensic fellowship at the USC Keck School of Medicine and completed her MPH at UCLA and her residency at Harbor UCLA, where she served as the chief resident. She serves on the Los Angeles Superior Court Criminal Panel and is a forensic psychiatrist at Department 95 LA's Mental Health Court. She's highly revered, as I mentioned, by her trainees and the ones that I'm connected with went on to work for her, so that tells you something as well. And she's published in peer-reviewed literature related to decriminalization, differential incarceration by race and ethnicity, and a number of articles related to highly marginalized populations, such as those living with HIV and who are injection drug users. I did want to share a bit from her recommendation application because it was just so beautifully written by Judge James Bianco in California. And he said, Dr. Ochoa's impact on the criminal justice system in Los Angeles for people with behavioral health needs is so profound that it's hard to know where to start. She was the first employee in the Office of Diversion and Reentry and began some of its programming months before her actual start date. She has been the driving force behind every one of ODR's programs, all of which are hugely successful and have led to the release of nearly 6,000 people into supportive housing and other programming over the past 5 years. And he ends by saying, there are many, many other examples of Dr. Ochoa's work. She simply gets things done without fanfare or attention. So I'm glad that we're getting the opportunity tonight to recognize her and to provide her with that attention. We know that's not why she does the work, but I am grateful for the opportunity to recognize Dr. Ochoa and to have her here with us.
Thank you so much, Dr. Vincent. We believe that Dr. Ochoa has experienced some technical issues because we believe we have lost her from our panel group here, but we are wondering if maybe, we might move on to the next piece and allow her to rejoin back in with us. So we're actually going to jump to Justice Zinoff. Yep, thank you so much.
Sure. Good evening, everyone. Our final award this evening goes to Dr. Mark Muniz. In discussing his nomination, the selection committee recognized that he has made unique contributions to this field throughout his entire career. Dr. Muniz, with his co-author Patty Griffin, is responsible for conceptualizing the sequential intercept model that underlies criminal justice and mental health collaborations across the country. As one of the selection committee members noted, it is like he invented the light bulb. The sequential intercept model has recently been modified to include crisis services and is currently at the heart of the National Judicial Task Force recommendations for communities working to improve outcomes for people with behavioral health needs. The sequential intercept model is not Dr. Muniz's only contribution. He is recently retired from years of service at Ohio's Criminal Justice Coordinating Center of Excellence at Northeast Ohio Medical University. During those years of service, he encouraged and led research, training, and thoughtful planning throughout the state of Ohio. Dr. Muniz has long been generous in sharing his expertise, traveling around the country, pre-COVID, of course, as a trainer, and providing guidance to criminal court judges as part of JPLI's trainings organized by state judicial educators. He has also shared his expertise in important meetings convened by the Council of State Governments Justice Center and other organizations. I've had the personal privilege of meeting him at a number of these meetings, and I have personally observed his sharp intellect, astute observations, and unparalleled passion for this work. Dr. Muniz has been a leader in his community, his state, and his brainchild, the sequential intercept model, has become a touchstone for communities throughout the nation. Dr. Muniz, on behalf of the JPLI leadership and the selection committee, it is my distinct honor to present this award to you that is a Lifetime Achievement Award. Congratulations to you, Dr. Muniz.
Well,
we're happy to hear from you at this time.
Yeah, thank you so very much. I can't tell if I'm being heard.
You are. We can hear you.
Terrific. Thank you so much, Justice Zinoff. I am very grateful to the APA Foundation and the CSG Justice Center for this wonderful honor. Very unexpected. And it's especially meaningful because it's in memory of Judge Stephen Goss. I had the pleasure of meeting Judge Goss during JPLI planning meetings, and I got to know him when he and I twice were paired to conduct statewide judges training on mental illness in the courts. He was a wonderful communicator and a committed advocate for people with serious mental illness. And as we heard, he was just a very nice, caring man. Addressing the wicked problem of the overrepresentation of people with serious mental illness in the justice system is not a solo activity. Any impact I have had in this work is the result of strong collaborations with many people. So I have lots of people I want to acknowledge, and I will not come close to naming them all. I will start, of course, with my wife, Dr. Lois Friedman, my wisest advisor, strongest support, and best friend. We recently celebrated our 45th anniversary. A different kind of strong partnership developed over the past 2+ decades between the Summit County Alcohol, Drug Addiction, and Mental Health Services Board and Northeast Ohio Medical University, NeoMed. More recently, PEG's Foundation has joined this public, academic, private partnership. This allowed for the creation and growth of Ohio's Criminal Justice Coordinating Center of Excellence. We call it the CJCCOE, which supports Ohio's 88 counties in their jail diversion efforts. The CJCCOE is 20 years old this month and going strong under its current leader, Ruth Samara. I had the idea for the center when Drs. Mike Hogan and Dale Svensson at the Ohio Department of Mental Health were creating CCOEs in Ohio in the early 2000s. Hank Stedman of the Gain Center had the vision for what he called a state level or mini Gain Center. I believe we helped realize Hank's vision. This was possible because of the support of leadership at both the Summit County ADM Board and NeoMed, continued funding 1 year at a time by the Ohio Department of Mental Health and Addiction Services, and a wonderful array of staff and consultants. At the start of the CJCCOE, Mike Hogan insisted that I come up with a model for the work we were trying to do, because there wasn't much evidence for these interventions yet. Thanks to Patty Griffin and Hank Stedman at the Gain Center, the sequential intercept model emerged and has had an impact far beyond what we ever imagined. Models and programs depend on the people who implement them, and I've had the good fortune to work with some great people. My partner in crisis intervention team, CIT development, was retired Akron Lieutenant Michael Woody, who became the founding president of CIT International. I was taught nothing about us without us by the late great consumer advocate, Dr. Fred Fries, who supported my work on assisted outpatient treatment when it was not in favor. How lucky could I get but discover a justice of the state Supreme Court who cared about these issues? Justice Stratton was a partner from the start of our center and made a huge difference. Another essential state partner was NAMI Ohio. We also had great partners at the national level in addition to the Gain Center. I learned a great deal from my friend and colleague, Dr. Fred Ochoa, longtime Director of Health Systems and Services Policy at the CSG Justice Center, from Judge Leifman, who's here tonight, from E. Fuller Torrey, colleagues at the Treatment Advocacy Center, Sam Cochran and Randy DuPont, creators of CIT, and colleagues at CIT International all deserve great thanks. As a result of so much help, tonight I received this wonderful honor. I think my work has made a difference in the lives of people with serious mental illness. But whatever we have accomplished only begins to address this terribly complex problem. The problem is systemic at many levels and cannot be solved by psychiatrists and judges alone. Society at large has much to fix. While we advocate together for those larger social changes, I encourage psychiatrists, especially young psychiatrists, to engage in this work. They should get to know a judge or a police chief or sheriff, a prosecutor or a public defender. Working together, they too can make a difference, and the work is incredibly rewarding. So I want to thank you again so much for this wonderful honor, and wish you all a great evening.
Dr. Muniz, thank you so very much. I'd like to turn it back. I think we have reconnected with Dr. Kristen Ochoa. Dr. Ochoa?
Yes, hello. Hi. I hope you can hear and see me.
We can both.
Great.
Dr. Ochoa, you probably missed Dr. Vinson's wonderful introduction of the award if you dropped off. So we just wanted to give you an opportunity to share a little bit about the work that you do in LA's Office of Diversion and Reentry, and kind of what it meant to win the award.
Oh, thank you. I really appreciate this opportunity, and for the thoughtfulness of all of you and everyone who's taken their time to be on this Zoom tonight. It's really a big honor, and honestly uncomfortable being in the spotlight. And I really want to hear Dr. Vinson's story later, but I'm also glad I did it because I'm sure it's embarrassing. I do want to, for me, this work is just very much not about me. It's for the people that we serve. And I really want to highlight the work that our office does. Again, we're with the Office of Diversion and Reentry in Los Angeles County. And we've had this opportunity. We began officially in 2015, but really in 2016 to try to transform the system in terms of diverting folks with serious mental disorders out of our Los Angeles County Jail, which is tragically one of the largest mental health facilities, or if not the largest in the world. Any given day, there are just under 7,000 people now who are in jail mental health housing. So we have a crisis, and we have a team and a lot of people who are supporting our team, our partners, who really make this work. It is truly them who have really, I think I'm like the face of ODR sometimes, or as my team says, the front of the house, just by necessity. But really, it's the team who's the back of the house and really making it all go, as well as our partners, as well as Judge Bianco, who I think had a big hand in nominating me for this, and did some writing, and is really to make this happen, and is really one of our major partners in ODR, as well as our other criminal judges and Hollywood mental health court judges who really make this all work. So I just wanted to say a little bit about the work that we do. We have thus far diverted more than 6,000 people out of the jail and into housing and care, both clinical care and also just interim housing, followed by permanent supportive housing for the majority of folks that we work with. We do this through elaborate court interventions in the adversarial process in court, and try to present our resources to justice partners so that we may earn the privilege of treating someone in the community. And then we work very hard to keep them in the community with us. And people often ask, like, what our success, why we're successful, and we have fairly low recidivism or rearrest rates, and we have high housing retention rates. And I think it really comes back to very simple things, which is we really don't give up on people. And one of our approaches is very non-bureaucratic, which is just simply providing people with basic care, love, a home, medicine. And I do dare say it's really that simple. And I think that's why we've been successful. And honestly, it's our clients and our patients who are doing all the hard work. But most of all, I just want to really thank the team in ODR, my colleagues who I'm so honored to work with, who through COVID risked their lives inside the jail and in other places where we never stopped serving people, and who really would do this work without me. And because they have such a fire in their hearts and such a mission to do this work. So I really want to accept this award on behalf of them. That's all I've got. Thank you.
My name is Evelyn.
My name is Susan.
I'm her daughter.
And of course, I'm her mother. I had not been officially diagnosed and was primarily using alcohol as a medication for a number of years. And it wasn't until I was 55 or so that I got the first diagnosis that I was able to hear. I had been in a mental hospital. I checked myself in when I lived in Virginia because I knew I was way off. I knew for a long time I was not like other people. And I thought it was just because I was an artist, but I was actually mentally ill and didn't know it. Symptoms of that and manifestations of that, and how disruptive it is in my life as well as that of my family. There was essentially no treatment, no understanding, no communication, but it's hard for Emily to remember that.
Well, it was really awful to see my mom in restraints in a small room when I knew she needed more than just what seemed to be punishment.
But I recovered from that, but unfortunately I didn't recover from the problems associated with bipolar. And it's been a pretty lengthy educational process, I think, for all of us, in the medical profession as well as for people like me. I would hope to encourage everyone to keep doing the good work you're doing and helping people like me. I consider myself white, middle class, educated woman, not suffer some of the abuses of the system that was in place years ago. And the sooner you can take stock of the reality of your life and get the help you need, it's abundantly out there now. I'm so glad that I can tell you that. Years ago, it wasn't here.
Well, and it was a one size fits all.
Yes.
And as a family member, I'll tell you how this came. I saw the change in the system myself was, in the pandemic, I think we all had a tough turn, including the two of us.
Right.
And there were times where, if we lived in Boulder and this was 20, 30 years ago, law enforcement would have been the option, but we had a mobile crisis team that could come out and talk to us and, wanted to talk to mom alone. Do you want to share what that was like?
I was in a lot of fear at that time. When I become unstable, I'm aware of it, but I lack an ability to change it on my own. And it was explained to me that sometimes hospitalizations are required. Get a person that's gone so far off the grid back on track and functioning independently again. So it was explained to me why these hospitalizations were required and what the solution was. And that I want to emphasize, the solution, because it's going to be an ongoing permanent problem my entire life. And that is finally stuck as a truth that I know applies to me. And the sooner, if you're a patient, that you can get there, the better off you are, because there are solutions in place that spare you the fears and anxiety that I've had to experience.
But they're choices that at the end of the day, you're the one making them.
Right, now I am, yes.
Yeah. And I like that.
Hi, everybody. My name is Fader Tao. I'm a program director on the behavioral health team at the CSG Justice Center. I wrote down what Dr. Ochoa said about we just don't give up on people, and what inspiring words those are for the work that you all are doing and that we all are doing. It is an honor to be here tonight to recognize these leaders from around the country and to honor Judge Goss's memory. As you've heard, we at CSG and at the JPLI do training for judges. We also work on policy issues, and from around the country, we had heard about the importance of a growing number of people in jails awaiting restoration of competency. So they were waiting for a spot in state hospital where they would receive medication and training on the legal system that would position them to assist in their own defense. And while this constitutional right has existed for a long time, we have been hearing repeatedly around the country more people waiting in jails, as well as states being sued when they were unable to provide restoration services in a timely manner. So this seemed like a perfect issue for the Judges and Psychiatrists Leadership Initiative, bringing together legal and clinical expertise. We also recognized that this was inherently a three-branch issue involving the courts, state mental health administrators, and the legislature. And so we were very happy to partner with a number of other nonprofit organizations, the National Center for State Courts, the National Conference of State Legislatures, and the National Association of State Mental Health Program Directors, to bring together an advisory group of a couple dozen people with all different expertise on this question of how can states rethink how they use competency to stand trial. And the result is the report that we're showing you right now, called Just and Well, Rethinking How States Approach Competency to Stand Trial, which articulates this as a national problem and also provides 10 very concrete strategies for states to improve outcomes in this area, grounded in the experience from around the country. So I'd like to, if we can get our videos going, I'd like to turn it over to a short video we have that features our JPLI co-chairs explaining how competency to stand trial works and some of the recommendations in Just and Well. If we haven't arranged our audio yet, I will just turn it right over to Chris Seeley to moderate our panel, which just has a wonderful selection of experts who are doing this work in their states, as well as two of our honorees tonight.
It's well-intentioned in that you're trying to protect people's rights. But what we've seen happen is that the process that starts, one of competency restoration, which often involves having to go to a state hospital, which may be overcrowded and may take a lot of time to get to, can be a very long process, can be a very expensive process. And it gets that person to where they can resolve their case, which normally doesn't involve a trial at all, because most cases don't go to trial. It normally involves a plea. But it doesn't help them with what happens next. It doesn't help them with treatment or with sort of long-term management of that issue that was the problem in the first place.
So in Florida, for instance, if the person is adjudicated incompetent, but they're charged with a misdemeanor, there's no restoration process to get the person competent. We basically release the person back to the street, We may try to get them restored in the community. It doesn't work very well, and often they'll just disappear back into the community until they get picked up again or they get picked up on a warrant. It's a really messy system.
There are gaps in services in the community which can lead people to become involved in the criminal justice system, and that ironically involvement with the criminal justice system may be a pathway for an individual to get mandated services that may not be available to them in the community when they're not justice involved.
Not surprisingly, we have seen mental health problems increase. So this is a time where our mental health budget and our mental health resources need to be used widely because of the increases we're seeing in mental health problems in the population as a whole.
A couple things that we're doing when somebody comes into jail, we screen them. If there's an indication of competency, if it's a misdemeanor charge, we do not order competency evaluations. We're saving the county about $1 million a year just by not ordering evaluations. We set up both a pre and post arrest diversion system. So we have trained over 7,600 police officers and crisis intervention team policing. And I'm telling you this because it's not really about fixing competency. That's not the problem. The problem is we have a structurally broken mental health system that is pushing people into the criminal justice system unnecessarily.
Thank you so much, Hallie, Judge Leifman, Justice Boggs, Bill, Justice Stratton, Dr. Ochoa, Justice Zinoff, Dr. Vincent, and Dr. Muniz, for all of your perspectives that you've shared so far. It is my pleasure as the Program Director for School and Justice Initiatives with the APA Foundation to introduce our esteemed panelists this evening to discuss just and well and competency to stand trial. First, it is my honor to introduce Dr. Debra Pynels. Dr. Pynels serves as the Medical Director in Behavioral Health and Forensic Programs for the Michigan Department of Health and Human Services and the Director of Program in Psychiatry, Law, and Ethics at the University of Michigan. She holds leadership positions in numerous state and national professional organizations, including the American Psychiatric Association, the American Academy of Psychiatry and the Law, and the National Association of State Mental Health Program Directors. Thank you so much, Dr. Pynels, for joining us this evening.
Thanks, Chris.
Next, it is my honor to introduce to you Sue Abderholden. Ms. Abderholden is the Executive Director of NAMI Minnesota, and in October we'll be celebrating 20 years in this position. And thank you so much for your commitment to individuals like me who have a mental illness. She brings with her over 30 years of experience in nonprofit and advocacy work. And Ms. Abderholden has been pivotal in helping Minnesota address competency to stand trial issues. Thank you so much, Ms. Abderholden, for being here with us this evening.
Thank you.
And we will also be joined by two of our award winners this evening, Justice Evelyn Stratton from Ohio and Dr. Kristen Ochoa from LA County. Welcome again and congratulations on the well-deserved awards.
Thanks, Christopher.
We are going to start out the panel discussion with Justice Stratton. Justice Stratton, how have you used your role as a judge to convene diverse stakeholders to make sure there's a shared understanding of the current competency to stand trial process?
Well, I actually started working on this in 2006, believe it or not, when I had my advisory committee on mental illness as a justice. We put a group together. We had the Department of Mental Health very involved, some psychiatrists on staff there. And we ran into a wall because we could not persuade our prosecutors to be willing to drop charges, because we really didn't have many alternatives for it, and they were not willing to let them out. They would rather have them in a hospital bed for that short period of time than out on the street. So we actually started again working on this about 4 or 5 years ago, when we got a updated AOT statute passed that made it much more clear that courts could establish outpatient assisted treatment. And we looked at that, maybe that was an opportunity. So we put another committee together. Now it's under the Attorney General Task Force with OMAS. Our Department of Mental Health is a huge partner, and started looking at it again. And we fortunately had a benefactor in Senator Gavarone, who is also a lawyer, and she really took this issue under her wing. We had a very diverse group. We had probate judges, because AOT is a civil process. We had criminal judges. We had prosecutors, defense attorneys. We had psychiatrists. We had treatment professionals. We had docs that actually did the competency evaluations. And everybody had a part, because it was a very complex issue. We were trying to meld a criminal system with competency evaluations with a civil system, which has got a lot of privacy concerns and a lot of HIPAA issues and many different rules than the criminal system, and trying to figure out how we could work between those. So what we really focused on in our first bill, which we passed last month unanimously, I will say, after 23 versions, so it was a lot of compromise, but it did get through unanimously. And that really looks at the legal issues. We aren't tackling yet all the practical implementation issues, but the legal issues. How do you transfer to AOT? How do you get the permission from AOT to let a prosecutor know that a person's gone AWOL, not working on their treatment? How do you connect them with services? And one of the things we put in the bill is that you did not have to release them from a hospital until you had housing and until you had treatment in the community, because we didn't want to just release them to the streets again. And opportunity, lots of opportunity for diversion at the misdemeanor level. So that bill takes care of what I think of as the legal issues that were impediments to working together between the two systems and Department of Mental Health. And now we're going to work on implementation issues. Our Department of Mental Health has put a lot of money behind forensic centers, behind treatment. We're really working on the housing piece, because you can't release them to the street. Doesn't do much good to treat them that way. And now we're going to do a lot of education of judges and trying to get more AOT programs established to actually make it work. It's one thing to say, here's it on paper. It's another thing to create all the resources that you need then to have effective treatment. So that's kind of the process we took in Ohio, but there were a lot of people that came together, and our senator was relentless in pushing this and making sure it happened and got through the legislature so we could fix those hurdles.
Thank you so much, Justice Stratton. And I think, when these policymakers are getting together and kind of making sure that they are making decisions that are going to be impactful, for the individuals who are experiencing mental illness. I think it's crucial. And I'm wondering, Ms. Abderholden, if you could jump in here on how should policymakers think about bringing people with serious mental illness, their families and their advocates to the table to make sure that when we are making these policy decisions, that the people most impacted or who we're hoping to have the most positive outcomes are at the table.
Thank you. And I think it's crucial. You can't make policies without the people who are impacted being at the table. Fred Fries, of course, certainly a hero of mine, said, nothing about us without us. And I think that that's really true, because we can sit there as policy experts and legislators and other policymakers and say, well, we think this is what you should do. But if you haven't actually talked to the people who are impacted by it, it may not actually be the best solution. And sometimes we create policies that are so difficult to understand that it doesn't work. And I think we have to think about this not just as kind of formal advisory committees, which are important, and in our committee that we created in Minnesota, we did make sure that people with mental illnesses and family members were at the table as well. But also we have to go to where people are. We can't expect them to come to where we are. So going to drop-in centers, talking to people who are in jail, talking to family members, going to NAMI meetings, mental health association meetings, so that you're really asking people questions, so how did this happen to you? What would you have liked to have happened? What could have made this better? What were the barriers that you found are really, really important if we want to create policies that actually work.
Yeah, I think that seeking to understand the individual and understanding what they might need, I think is super crucial. And I'm wondering, Dr. Ochoa, if you can jump in here and maybe provide some insight in what do people likely to be incompetent to stand trial need to succeed in the community?
So what we found is just really creating a home environment. Once people are out and those who are homeless come to us, we really allow for the home environment, which is much like just a single family home in a neighborhood that looks just like any other house. That's sort of our model. And it's really, again, sort of like not so much about us, it's about the community that gets created at that house among peers, among other folks who are also incompetent to stand trial. They share a lot in common in terms of they all came from jail. They have that shared experience. They also are all in the same program. They have the same court order, and they all support each other. It's really fantastic to see that sort of support. And I think at the end of the day, that we can't fool ourselves that it's really us and our amazing clinical capabilities, keeping people in the community and successful and not back in jail. I think honestly, it's the community that gets created with the staff that are at the house and among people who are peers. I think also, I do really believe it's treating people in an excellent way clinically in terms of the, medication. We know we take that really seriously and try to really give people a chance in terms of giving them the best shot at robust doses of medication, including long-acting injections, which are a big part of our, our secret sauce, I suppose.
Yeah, and I think, and kind of going back to Ms. Abderholden here on the asking of the questions, I think sometimes, right, and seeking to understand maybe what are those additional needs sometimes. And I'm wondering, Dr. Ochoa, if you could jump in again, thinking about kind of the program and ODR and what you have established, and how has equity kind of played a role in figuring out what it takes to have people succeed in the community?
Yeah, we actually, our group did a study on the jail mental health population. We actually were looking at the population for a different reason, and when we saw that there was such huge racial disparities between the jail mental health population and the general population, we couldn't sort of turn away from that, and we felt compelled to publish it. And it's that basically African-American folks are overrepresented in the jail mental health population. And so we really, when we are doing our own diversions and cases and working on these cases in court, we're really cognizant to make sure that also our work and the folks that we're serving reflects the population inside the jail. So that's just one really thing that we always have in mind. We also have a staff that who are diverse, and that's really important, and our providers who are literally from the communities where our clients are from. So this work means a lot to them. They get it. And I think that's a really key part of our success as well. People are going back to the communities that they're from oftentimes, and all of this work and this care is happening in an integrated way within the community.
And I think, when we know that making it to your first appointment and liking your provider or being engaged with your provider are two of the key indicators of someone returning to services, I think making sure that the providers that you're bringing to the table are from the community and understand the community that they're serving is crucial to make sure they don't return to you and that they stay community members, which they were before any kind of criminal record was put upon them either. So, Ms. Abderholder, I am wondering if you could jump in here, given some of the work that you've currently been engaged with on how states created and funded community-based care, and what are some of those barriers or opportunities to succeed that you've seen out there?
So one thing I want to say, and some people might view this as controversial, is that our mental health system isn't broken. If you look at the history, it's never been built. The state hospitals were not a mental health system. And so what we've really been trying to do the last 40 some years, right, is to try to create those community-based services. A lot of reliance has been on Medicaid, and Medicaid expansion has certainly been helpful in making sure that people can access mental health treatment and not rely on charity care. But we also, frankly, have not pushed private insurance to cover what they need to cover. And so if you look at what's offered in a Medicaid benefit versus private insurance, I mean, it doesn't even match up. Private insurance rarely pays for adult residential treatment. It doesn't pay for mobile crisis services. It doesn't pay for intensive home services or anything like that. And we also haven't looked at the social determinants of health when we're looking at our mental health system, which would include housing, employment, and connected to others as well. I think we have seen some things that have worked well, including, supportive housing, certainly more intensive services, first episode programs. So we're really kind of providing intensive services early instead of waiting till someone gets really sick. But I think for too long we've relied on grants, and as anyone who has lobbied any state legislature knows, those are the things that get cut during any time of economic downturn. And so they aren't a very reliable source, frankly, of funding for our mental health system. And that's what we relied on for way too long. The one thing that we're actually trying to do in Minnesota is, in all the commitment statutes across the country, right? We wait till someone gets really ill, and it's a one and done. So, maybe you have a mobile crisis team come out, the person is struggling with their mental health, they don't meet the commitment standard, and so they leave and they're not interested in treatment. Why is that? Why aren't we going back the next day and the day after that and the day after that? And if you look at what homeless outreach workers do, right, they create a relationship with that person. They don't just ask them once if they want housing. They go back over and over and over again. And that's what I think we need to think about doing too. And the other thing I want to mention is that we also have to think about early intervention. We can't wait till people are adults. So we have to make sure that we're also building the children's mental health system so that we're really identifying and treating people early, making sure that they're not dropping out of school, making sure that they can progress to work or college or wherever it is that they want to go. But for too long, I think we have also just said, we're just going to focus on people who have the most serious mental illnesses instead of understanding this as a public health issue and that we need to get way in front of this.
Well, you were just after my own heart there, talking about schools as the director of school and justice initiatives and thinking about school to prison pipeline and just all of the different ways that we can move upstream to not be so focused on these jail doors. And I will say, I think there's a little bit of hope, even from our new president of the American Psychiatric Association, Dr. Vivian Pender, who just took the gavel. And one of her key focuses will be social determinants of health, which I think hopefully will continue to bring more light to how we can be a little bit more preventative instead of so reactive like we are.
And Chris, can I just mention, it's also an equity issue, because if you look at children, the children of color, their mental health system is the juvenile justice system. And so we have great inequities there. And so I think that's the other reason that we want to do this.
Yeah, exactly. And I'm wondering, Dr. Pynels, if you could jump in here and add on anything else on how states are looking to build out kind of beyond beds so that there is that robust system of community-based care before, during, after all of this.
Yeah, I think that what the prior speakers have said is, really spot on. The framework of Beyond Beds really looks at this, for a long time with the competency system, a lot of what you would see in the media is we need more state hospital beds. But as we heard already from Judge Leifman and others, the answer to the competency system is far more complex than building state hospital beds. And that really would be going in a direction that doesn't put the spending on all of those upstream community-based resources. So in terms of that continuum, lots of discussion right now about crisis services. I mean, I don't think there's a day that goes by that I'm not in hours of meetings talking about crisis services and the future of crisis services. We know that there's a lot on the horizon with 988 being passed as a unified number. There's a lot to learn about that. How is that going to work? Is that really going to lead to the right door for people at the right time? There probably will always need to be some law enforcement backup response for certain situations. So how do we make sure that the law enforcement officers are well versed in what they need to do if they come across somebody with either a serious mental illness or intellectual or developmental disability? And frankly, when I've spoken to class members in litigation around the competency system, there's a huge number that have co-occurring substance use conditions. So we've really got to think about integrated care across what we would say in medicine, multiple morbidities, multiple illnesses that are happening at once. It's not just co-occurring mental health conditions and substance use disorders. It's definitely those, but it's also medical conditions that are getting people into health problems. And all of this ties to social determinants of health. I mean, we know there's lots and lots of studies that look at who are the heavy utilizers of some of these kinds of services. And it's the people that are revolving between the criminal system, the forensic system, the emergency rooms, the mental health system. Those are a lot of the people whose complex needs need to be addressed in a holistic way, and really think too about prevention strategies. So beyond crisis services, we have to think about what's going to happen after the crisis. We also have to think about the people that do end up funneling into the criminal system deeper. And that's why I think Dr. Muniz, who I had the great good fortune of having as a mentor when I was very early out of residency and fellowship, what he did with Patty Griffin was really prescient and brilliant to think about making sure that we don't forget that there are going to be some people that still will get into the criminal justice system or criminal legal system, and then we'll be returning back. And how do we build in reentry services? And then one other point that I just want to offer, when you said about upstream and juvenile justice, ironically, as an adult psychiatrist and forensic psychiatrist who does addiction medicine policy work, one of the places that my career has taken me has been into the child welfare system. And I will never forget a case when I was running mental health courts in Massachusetts, and a woman came to a mental health court 2 weeks postpartum with a baby in a basket. She had a baby in a car seat that she had taken the bus for hours to get to this urban mental health court to show up, make sure she appeared. She was doing a fantastic job trying to manage her mental illness. And I was in awe because I thought, boy, I'm not sure I could have done that 2 weeks postpartum, taken that bus, gone to that mental health court, made that appearance. But I looked at that little baby and at the time I had been working with our public health administration and had become aware of a screening program for babies at risk. And they were at risk because they had parents who'd been incarcerated or who had, they were at risk for adverse childhood events. And there was a public benefit of a screening program for those infants. And so we were able to attach that mother, not just to her mental health court services, but her baby to that screening program to bring in supports really early on. So we know that child removals are very often related to parental mental health and substance use challenges. We know that there's disproportionate child removals of Black and brown children. And so we really have to go upstream, and not only looking at the children, but going even further upstream by looking at our adult participants as parents and really thinking about the whole family system and how can we support the family system. So when we talk about a continuum of care, I really think big, and I think there's lots of opportunities through creative blended funding and administrative linkages to really think broadly about what that continuum of care can look like for entire family systems.
One thought I just kind of want to add to that is that, as we continue to kind of build our systems out, is to remember that when we create something so separate that nobody knows about it, they never get there. And so, I hope 988 becomes, everyone memorizes that number. But right now, even in places that have crisis numbers, no one knows them, but everyone knows 911. And so just as we send out, fire trucks when there's a fire, police when there's a robbery, we need to be able to send out mobile mental health crisis teams as well. And everyone knows the emergency room. They know that. And so making sure we have a psych ER, right, within that same system, because that's the door that people know. And so I just worry sometimes that when we start creating separate things, no one knows about them. And then their way to the mental health system is through the criminal justice system.
I wish we could just continue this conversation around. I think a lot of times in this space of mental health and criminal justice, we always talk about diversion to who, and I think this how do we divert people away from trauma is such a wonderful question for us all to think about within our communities. And I wish I could expand on that more tonight, but I do know that we have more resources coming out in the future from the foundation around some of those topics. So Dr. Pynels, I do hope that you could jump in here and kind of continue on how have you seen judges limit the use of competency to stand trial to only cases that are inappropriate for diversion or dismissal?
Yeah, I would say Judge Leifman is our true hero in that regard, sending that message out around the country. I mean, one of the challenges with competency is, as it was pointed out by Dr. Vincent, it really is a fundamental right of a defendant to not have to face criminal charges or trial if they're not competent to stand trial. So it's using a right, it's a right that needs to be protected. And so when the question gets raised, it's very hard, I think, for a judge to turn that away. I think the states that have started to pass legislation that allows misdemeanors, like Washington, Florida, that allows misdemeanors to have an alternative pathway, gives that latitude to the system, to the players within the system to find those alternative pathways. So although there's great cases where there's prosecutorial diversion programs or mental health, post-arrest, post-booking, diversion, that space, once the defendant has been arraigned, if the competency issue is raised, it becomes more of a challenge. So I think legislation can help. I think judges that are more aware of these issues can also help by making the inquiry of whether a diversion option is available. And then maybe the case can be placed in abeyance before the competency issue is sorted out. And we really have to help people understand that sending somebody into the competency system isn't equivalent to sending them into the full array of a treatment system, because the issue becomes so focused on that defendant's skills related to and functional abilities just related to standing trial, as opposed to their functional abilities related to paying their bills and getting their groceries and helping them understand what their medication issues are. And so I think that's really important. The other thing I want to say is when there are those diversion programs and options that people consider, when they work, it's amazing. If they don't work, you lose trust pretty quickly. So Dr. Ochoa's program and I think her keeping it simple is exactly where it's at. It's really about engagement. Getting people to want the services is just as hard as building services. And so building a friendly environment that's respectful. We know a lot about therapeutic jurisprudence. We know that people will report feeling less coerced if they feel like they've been given information and given options, even if they have kind of forced options hanging over them. So I think just the old-fashioned treatment alliance is something that we really need to think about more. And a lot of times you go to jails and they say, we shouldn't have these people with mental illness in our jail. And you go to the community mental health system and they say, we shouldn't have these criminals in our community mental health system. Well, we have to stop saying that. We have to really start embracing the people that we have and really working to engage them so that we can keep them retained in services. Treatment linkage can be really successful. Treatment retention is really, I think, where it's at. So I really applaud the efforts of Dr. Ochoa and her colleagues to really engage people who have really, you know, there's a very high likelihood of distrust in the system for very good reasons, going way back to structural issues and a whole host of other factors. So really trying to build those bridges to make people feel like the care is what they want and what they need is really important.
Chris, if I could interrupt for a sec with one suggestion. One of the things we're doing in Ohio is, the best way to describe it is a rehab center for mental illness. We've established our first one in Athens County. And when they come out of a hospital bed where they can stay 2, 3, 5 days, or if they're sent for competency evaluation, but they don't need that level of care, which is horribly expensive and takes up 70% right now of our state hospital beds, we send them to the Adam Amanda Center where they can stay up to 90 days at a much reduced rate and get treatment and stability. And then we try to step them down into stable supportive housing in the community. And, you know, if you have a stroke, you don't go right home. If you have a heart attack, often you don't go right home. You go to a rehab center, and yet we, you know, release them from our hospitals right onto the street. So we're trying to build that rehab center, a concept, and we're starting our second, third. We've got about 2 or 3 more starting in Ohio around hospital centers, so that when they come out, they can do that. And the judge in Athens County now is using the Adam Amanda Center for competency restoration, where they don't need to be at that high level of hospital care, but they aren't quite ready to go out totally outpatient on the street. So I wanted to suggest that as something we really ought to focus on, because if not just with the competency, but with all mental health cases that aren't ready to be released to the street or to whatever environment, rehab center is really important.
We have those as well in Minnesota. That we actually have about 65 of them. We call them IRTS facilities. And of course, there's 16 beds so that you can use Medicaid.
We're trying to get that changed.
Well, and I think I want to highlight the importance of warm handoffs. And I think walking along the journey of mental illness with our community members, that's really what we're asking the communities to do, is to better understand our community members and our neighbors. And we do a training, a professional development for school staff. And what I often tell them with youth is that it's your role is to walk them to the door, right? It might take you 15,000 times to walk that youth to the door of support services. It's still their option to engage, but the more times you offer it, the better relationship you build with them, the more likely they are going to actually engage with those support services. Now, you might not see that success that might happen after you're done, but it's about that consistency and the compassion and the empathy in that delivery. I do want to end on one question here for both Dr. Ochoa and Justice Stratton here. I'm just wondering if both of you, I'll start with Dr. Ochoa, if you could give me maybe a 1 to 2 minute summarization of why it is so important for judges and psychiatrists to work together on this issue.
Okay, I'm gonna eat into my own time answering your question by reading something to you about the previous subject, because I really want to tell you guys this. So just back to the other topic related to keeping people in the program and what it takes. We had we often have clients write about their experience, and I have some quotes from a client and from one of our providers. I just want to quickly read to everybody. This is about a particular person who's a felony incompetent to stand trial. And he says he agrees that many members fixate on when the program will be over. But he said he also believes that new members don't even know how to adjust to an environment like ours, that it's very likely they've never been surrounded by people who are invested in their well-being, and that they've likely been chronically homeless or don't understand the concept of showering daily or having any type of routine. And this is a quote, that we have to get used to being in entirely different bodies sometimes. We come from the jail, fatter or skinnier than before. We haven't had drugs or nicotine. Suddenly these people say they care about you, but you don't even know what to say back or how to act. And I think that just really, of course, it brings tears to my eyes, but I think that's really what it's about. It's about just showing people that, unconditional positive regard and staying with them while they grow to accept it. So, and now for your question, sorry, Chris. I think that the relationship with judges is everything. And we really, they're our partners in this. And we've grown together. And we have some really amazing judges that we work with who are just as invested in the success of our clients as we are. And these are relationships that we work at. And that they work at too. And when we have the sort of relationship where when there are things that come up, we're pretty good at bringing each other into the communication, whether it's, texting, phone calls, or in the moment sidebars, just really being really open and honest about all of the doubts that we have. Because often we're all assuming a great amount of risk. And we are pretty cognizant of trying to share that risk with one another. So that's all I got.
Well, I think the added quotes and that information, I think that's wonderful. So I don't think that ate into anybody's time. Justice Stratton, same question to you. Why is it so important for judges and psychiatrists to work together on this issue?
Well, both are part of the competency system. You can't have one without the other. You can't get an evaluation and a determination by the judge if you don't have the psychiatrist. So what we did in Ohio is we had them on our committee, both. We lawyers and prosecutors and judges wrote a lot of the legal stuff, but then I took it to a psychiatrist who did 1,000 competency hearings in our big county. And I said, tell me what the practical problems are of how this really works, because it sounds good on paper. And he pointed out several issues that us legal beagles wouldn't have known, but he said were real issues. So we went back to the drawing board to try to fix those. And so you really have to understand each other's jobs and the limitations and the advantages and the resources that you have. We're very big on grand rounds. We're trying to get those started again. We used to do those where we go into psychiatry schools and we train the young students while they're young and inspired and full of do good, and come to a mental health court and see what it's like. Come to an AOT court, see what it's like. Train them as to what the criminal justice system does that affects their job as psychiatrists. So a lot of cross training. I think we stand together so much more effectively. We've used the phrase, the black robe and the white coat really make a difference in impacting the people we're trying to work with. And I think standing together and working together and training and understanding each other better will lead to a more effective system.
Well, I think that is a nice little bow to wrap up this panel here of not just judges and psychiatrists, though this is the judges and psychiatrists leadership. As we mentioned, having the individuals who are community members and our neighbors who are impacted by mental illness at the table as well is so important as well. So my great extended thank you to Dr. Pynels, Ms. Abderholden, Justice Stratton, and Dr. Ochoa for joining us and being a part of this panel. It is now my pleasure to pass the microphone over to Dr. Michael Champion, one of the JPLI co-chairs and an esteemed colleague of mine that I get to work very closely with. And Dr. Champion, I am going to share my screen again so the slides are on the screen and you can take it away.
Great, thank you very much. I have the pleasure and of wrapping up tonight and delivering some closing comments. I'd like to thank you all for joining us to celebrate and honor Judge Goss, our award winners, and also discuss the pathway to becoming just and well. I wanted to highlight for me what are some take-home points first, and that is a very interesting discussion of the last half hour, 45 minutes. And for me, the take homes are that the systems that we work in are quite strained and challenged, but they certainly can be revised and reshaped. And collaborative partnerships among many people, many types of professionals is needed, along with persistence and aligned efforts in order to turn the curve. And partnerships between judges and psychiatrists for collaborative problem solving and leadership is key to successfully turning the curve. And we encourage that model and approach within the Judges and Psychiatrists Leadership Initiative, and are here to support others as they do their work together in local jurisdictions. So the Just and Well project is codified in the document that's in the link in the chat, can really serve as a tool and a roadmap for a number of items, including developing off-ramps from the criminal justice and legal system into care, limiting the use and reducing the need and demand for competency to stand trial services, and improving efficiency, quality, and equity of the services that are delivered within the clinical and legal systems. Now, in honoring Judge Goss's life and work and acknowledging his passing, it's also important to emphasize the importance of self-care for everyone in this time of the ongoing pandemic, with all of its involved stressors. We need to talk about mental health and support each other. And so Chris is going to share a number of resources, 3 of them. One is a resource for supporting judges and court staff in promoting their mental health and well-being along with their colleagues during the pandemic. The second is a resource for psychiatrists and their colleagues in their work environments to address well-being and preventing and addressing burnout. And we also acknowledge that some judges and psychiatrists are also parents and caregivers in their families. And there's a resource called Notice, Talk, and Act at Home to help parents and caregivers stay mentally healthy through the public health emergency. And so as we close tonight, I want to revisit some of Dr. Ochoa's comments that I think are important as take-home points. It's really very simple in many respects, and I'll just kind of rephrase them and take some artistic license with it. We really need to recognize, respect, and support the humanity of everyone in the process. The people we serve are doing the hard work, and just remember there are no throwaway people. And I really applaud Dr. Ochoa for using the L word, because I believe that a core quality metric, although it's not traditional, is the amount and quality of love, with a capital L, that is infused into and reflected in the work that we do, and also in our personal lives as well. So thank you, Dr. Ochoa, for reminding us of that. So in closing, we encourage all of you all to sign up for the JPLI newsletter and encourage everyone to look for opportunities to bring together judges and psychiatrists locally where you live. We've seen tonight the strength, potential, and impact of these partnerships, and encourage all of those of you at home to think about who you might work with and actually do it. And we're here to support you. So thank you very much.